Hello everyone, I'm Dr. Mostafa Mabrouk, Associate Professor of Biomaterials from the National Research Center of Egypt. Today I'm going to give you a talk about nanomaterials for biomedical applications through our research example. We are very proud to have collaborators, local collaborators such as Al-Azhar University, Cairo University, and Mansoura University, and several other universities. Also, we have international collaboration with University of Witwatersrand from South Africa, University of Loughborough from England, Kyushu University in Japan, and some other institutes and universities all over Europe. This is my humble team, and I'm very proud to be one of this team. In the beginning, what is the nanomaterials? Nanomaterials, all the materials that are, all the nanoparticles or particles that are below 100 nanometer, we can consider it as nanomaterials. And this was discovered by Richard Feynman in his famous presentation. There is plenty of room at the bottom in the late of 15s, and since that time all material scientists are very busy to produce nanoparticles and improve and develop some method for preparing nanoparticles and also for characterization of this nanoparticle. In the last year, we have made statistical analysis using data from Scopus for published articles dealing with the design of nanomaterials, and we found that only to 12.5% of these publications are related to biomedical application, which is very low comparing to the momentum made for nanomaterials. And we thought we need to stress this out in a review article. We published this review article last year, and we thought also we need to all the nanomaterials scientists need to stress out the reproducibility of these nanomaterials, and also we suggest to import some assessment criteria from the industrial sector, such as quality by design, and by which we will judge the efficiency of this nanomaterials and in biomedical application, especially the complications that can be that can take place after introducing this nanomaterials in the human body. Material selection. Based on the application or the biomedical application that we need, we choose our nanomaterial. So if you are planning to make a scaffold or implantation that will be used in the human body for tissue regeneration, we need to have it biocompatible or biodegradable with suitable biodegradability and biocompatibility to the defect site. And also, if we are looking for drug delivery system, we need to improve the solubility and bioavailability of the drug and the carrier as well. The main factor or the very important factors are nanoparticle dimensions and shape as well, which are highly or greatly affecting the final feature of these nanoparticles in the biomedical application field. The preparation techniques in this is the major preparation techniques of nanomaterials. We have nano emulsion or micro emulsion, and sol gel technique, nano spray dryer, and nano electrospinner. Characterization technique such as zeta sizer, electron microscope, including scanning electron microscope, transmittance electron microscope, atomic force microscope, and the charge of the nanoparticles is very important in biomedical application. We move now to our research examples. We have nanocomposite scaffold, and we have nanofibers, microspheres, membranes, and multifunction nanomaterials. The first example is the composite scaffold from BG Bioactive Glass and Chitosan. This was published in Ceramic International Journal, and this is the procedure by which the bioactive glass was prepared, which is mainly sol gel method, and this bioglass was doped also with iron, and this is the lyophilization technique which has been used for the preparation of this nanocomposite scaffold. This is TM images and elemental analysis for the bioactive glass prepared by sol gel technique before and after doping with iron nanoparticles or iron oxide. We can see here that the nanoparticles prepared bioactive glass nanoparticles is the size of this nanoparticle is decreasing with increasing the concentrations of iron, and also the presence of iron was confirmed by EDX elemental analysis, as we can see here. This is the morphology and microstructure of the prepared nanocomposite scaffold. We can see here on the top left that Chitosan itself is very smooth pore walls and irregular orientation of these pore walls. With introducing bioactive glass alone without doping, we can see that the orientation of this scaffold is becoming is taking definite orientation, and also we can see that the porosity is decreasing with increasing the quantity of this bioactive glass, as can be also compared with the porosity measured by Archimedes method. And we can see that here after including bioactive glass doped with iron, this is more pronounced, and the pore wall here is becoming more rough, and the thickness of this pore wall is very high comparing to the other. And the compressive strength was also in this trend, and it was very logic with increasing the bioactive glass or nanobioactive glass filler in the composite or in the matrix or Chitosan matrix, so the mechanical properties is increasing as well. This is how we judge the biomineralization. We soak our sample in simulated body fluid for definite time, and afterwards we monitor the surface of these samples by scanning electron microscope, and we can see here that there is some precipitation or huge precipitation on the surface of the biocomposite scaffold made of calcium phosphate, as confirmed by the elemental analysis made by X. The second example is about PCL microspheres coated with dopamine, and this microspheres could be used for drug delivery or even for tissue regeneration. This microspheres was prepared by double microimmersion technique. Firstly, we make solution of BCl, and in this solution of BCl, BVA droplets was immersed in this BCl solution, and we have now the first emulsion. This first emulsion was titrated in dopamine solution, and we have now the double microemulsion. The morphology and the diameter of these microspheres was determined by scanning electron microscope, and it was confirmed that the presence of dopamine or the concentration of dopamine is decreasing the particle size of this microspheres as it is increasing the repulsive force between the microspheres itself. And we found that the presence of dopamine is also increasing the surface area and pore volume as well. Scanning, this is how we tested the mineralization on the surface of this microspheres, and we can see here before immersion in SPF, and this is after immersion in SPF, and we can see and confirm by the scanning image that there is a precipitation of minerals, calcium phosphate minerals, as confirmed by EDIX elemental analysis. In the biocompatibility test, we found that the cell adhesion on the surface of this microsphere is increasing with increasing the dopamine, as we can see here in the last image. This is another example about wound dressing, and this wound dressing was prepared by PVA calcium silicate nanofibers. The morphology and the nanofiber diameter was found to be affected with the presence of silver agent or zinc agent, as can be seen here in the top images. It can be seen here that increasing the concentration of zinc is decreasing the diameter of this fiber, and on the other side, silver is increasing the particle or nanofiber diameter. But in the presence of both together, zinc is having the dominant effect. This is precipitation of calcium phosphate when we submerge these nanofibers in simulated body fluid, and we can see also the degradation of these nanofibers over time, as well as pH. This is proving the antibacterial effect of these nanofibers against Staphylococcus aureus and Pseudomonas aeruginosa strains. This is another example of our nanoparticles, which was prepared by magnetite nanoparticles coated with Chitosan, loaded with ciprofloxacin drug for antimicrobial effect and imaging as well. So we prepared these nanoparticles, and then we make copper substitution, full substitution and partial substitution for ferrous in for magnetite structure. And this was the magnetization properties, and we can see that magnetite is having the super paramagnetic properties. And this is TM characterization for the morphology and nanoparticles. We find that incorporation of partial substitution is having the finest nanoparticles, comparing with complete substitution with copper. Also, we confirmed the antibacterial effect of these nanoparticles using hollow method technique as antibacterial test, and this is the drug release of these nanoparticles, ciprofloxacin drug release, and we found that presence of copper is down regulating the drug release from these multifunction particles. Another two examples of our nanoparticles: this calcium silicate was doped one time with copper, different concentration of copper, and another time with different concentration of iron oxide. And we can see that the morphology of these nanoparticles and the diameter of these nanoparticles is decreasing with increasing the dopant, as we can confirm here by the TEM images. Also, this samples doped with copper, and we can see here the huge precipitation of calcium phosphate present on the surface of these nanoparticles. And this is this nanoparticle was used to treat bone fracture, and we can see here the high doping of copper is having very great effect on the healing phenomena of these nanoparticles. This is also for iron doped nanoparticles, and we can see here also the huge precipitation of calcium phosphate or carbonated apatite on their surfaces, as confirmed by EDIX analysis. In the conclusion, we have prepared successfully some different materials or nanomaterials for the biomedical application, including drug delivery and regeneration or tissue regeneration. Choosing the preparation method depends on both the desired application and the selected materials. Teamwork and fun are very important to conduct such research. Thank you all for your time.